I would like to talk to you today about an issue that needs more awareness and is very personal to me. That is fibromyalgia. I'm going to show you why there needs to be more funding for research to find a cure, as well as why this disorder should be taken more seriously as a disability. You may have never even heard anything about it, or you may personally know someone who has also been diagnosed with it. Fibromyalgia is a condition that is something I've been struggling with for most of my adult life, although my symptoms first started in my adolescent years. It has come to impact every aspect of my life. One of the biggest struggles that I've faced is the fact that it's a mystery disease that many people have never even heard of, let alone have any idea what it is. It's not like telling someone that you have cancer and they immediately know what an awful disease you have and that you're struggling with and what it entails. This is a relatively new diagnosis for the medical field, and there's not nearly enough research or awareness. And I'm going to share some information with you about what fibromyalgia is and what it's like to live with to show you why there should be more funding for research, more awareness and information available, as well as why it should be taken seriously as a disability by the government and insurance companies. So, what is fibromyalgia? Well, I'd like to give you all some information on the subject and let you in on what my world is like. Fibromyalgia is the most common musculoskeletal condition after osteoarthritis. Even though fibromyalgia is frequently referred to as an arthritis-related condition, it doesn't cause joint damage or inflammation and can, like arthritis does. However, it is similar to arthritis because it causes severe pain and tiredness and can undermine the patient's ability to go about his or her daily activities. Fibromyalgia is seen as a rheumatic condition because a rheumatic condition is one that causes joint and soft tissue pain. Fibromyalgia is a long-term or chronic disorder that tends to get worse over time. It's associated with widespread pain in the muscles and bones, areas of tenderness, and general fatigue. Fibromyalgia is often associated with areas of tenderness which are called trigger points or tender points, and these are used in aiding the diagnosis for this disorder. These are places on your body where even the lightest pressure can cause pain. I know I have a few spots that are bundles of nerves that if you even touch it in the lightest way, it feels like someone's trying to break a limb. It's very annoying and inconvenient to live with. Symptoms like these are considered subjective, however, meaning that they can't be determined or measured by tests. I know I've had nerve conduction studies done, and they led to more pain and no significant information that helped with anything as far as where the pain's originating from or the levels or why I'm feeling the pain that I do. Because its symptoms are subjective and there isn't a clear known cause, fibromyalgia is often misdiagnosed as another disease and can take years to come to a proper diagnosis. There are also many other symptoms that a person with this disease may experience, including headaches and migraines, IBS or irritable bowel syndrome, painful menstrual periods, restless leg syndrome, fibrofog, which is memory problems or cognitive problems. I know that I have the mind of an 80-year-old when it comes to remembering things as short-term memory goes, and I'm only 33. So it definitely exists and is a real thing. Widespread pain, nausea, weight gain, dizziness, cold and flu-like symptoms, and depression and anxiety, myofascial pain syndrome, which is pain or tiredness in muscles and adjacent fibrous tissues. And then the list goes on. There are many other symptoms that you can experience, as well as the problem with constantly being in pain and constantly having these symptoms that can feel cold or flu-like, along with breathing issues and the other issues that go along with it. It taxes your immune system, basically. And when the immune system has no time to recover and actually get better to do its job, then it doesn't do its job properly, which leads to a weakened immune system, therefore more frequent infections and illnesses, and it's kind of a vicious cycle. The lack of objective tests for this disorder causes some doctors to question the disorder altogether. While it's becoming more widely accepted in medical circles now than it was previously, some doctors and researchers still don't consider fibromyalgia a real condition. And according to the Mayo Clinic, this can increase your risk of depression, which stems from a struggle in gaining acceptance for painful symptoms. This is definitely true, not only when it comes to medical professionals, but also family and friends. When you feel like nobody understands you, or no one listens to you, or no one even believes you, it can definitely lead to worsened depression. Researchers are getting closer to understanding fibromyalgia, so the stigma that surrounds the condition is starting to disappear. But the more that doctors begin to accept this diagnosis, the more likely the medical community is to explore effective ways of treating fibromyalgia itself, which at this point there's ways to treat the symptoms, but there's no actual cure. And we need to work towards finding a cure to actually eradicate the disease from the body rather than just put a Band-Aid on a gaping wound by treating the symptoms. Fibromyalgia is actually very common. According to reported cases in the USA, approximately 1 in every 73 American adults suffers from fibromyalgia. That means if you've got 100 people on your Facebook friends, chances are at least one of them is going to have been diagnosed with this disorder. The American College of Rheumatology says that between 3 and 6 million Americans actually have fibromyalgia. The National Institute of Health says that 90% of these fibromyalgia patients are women. However, men and children also may be affected. And although symptoms may become present at any time during a person's life, they are most commonly reported when the person is adult to middle-aged, basically anywhere between 20 and 40 years old. People who suffer from rheumatoid arthritis, lupus, or spinal arthritis have a higher risk of developing fibromyalgia, as well as patients with some other rheumatic or autoimmune disorders. I do have degenerative disc disease, which is a form of the spinal arthritis, and I've had one spinal fusion surgery about 2 years ago and found out about 8 months ago that I am in need of another fusion surgery, the disc one level above where my initial one was. However, I'm about 5 months pregnant right now, which is not only causing more issues with my fibro flaring up, but that also means putting off any further back correction surgeries until after I've had my baby and have had time to recover from the surgery that's going to take. Studies have also indicated that fibromyalgia may also be hereditary. Females that have a close relative with fibromyalgia have a significantly higher risk of suffering from it themselves. Experts are not certain whether there's a genetic link, circumstantial, or both. I personally have 2 other female cousins who have also been diagnosed with fibromyalgia, which leads me to believe that there is a genetic link. So what causes fibromyalgia? Experts say there are probably a number of factors. However, nobody's really sure what causes fibro. Factors such as traumatic, stressful, or emotional events may be linked to developing fibromyalgia. Possible causal factors could include a stressful, traumatic, physical, or emotional event causing post-traumatic stress disorder, or things like a car accident, repetitive injuries, rheumatoid arthritis, lupus, central nervous system problems, or the way our genes regulate how we process painful stimuli. In my own case, I began having symptoms and problems when my body went through puberty. As we all know, this change alone can have a traumatic effect on the mind and body. It's also believed that the hormonal changes may have played a part. However, I began experiencing the intense chronic pain issues after I had a very traumatic birth with my oldest child at the age of 22. I had a placenta abruption and was forced to have an emergency C-section with absolutely no anesthesia or pain medication until they were actually sewing me up due to the urgency of the surgery. I had lost a lot of blood, and my daughter's heart rate had dropped to 64 beats per minute, which at that point should have been around 150. And when I was told by the doctor that my baby was in trouble and they had to get her out now, and that the anesthesiologist was going to be at least another 10 minutes before he could get to me, and they couldn't wait, I told them to do what they had to do and save my baby, and they did. They did an amazing job, and she's now almost 12 years old and healthy and happy. I can only compare the birth experience to I've had nightmares of still being alive while on an autopsy table. I could actually feel myself being basically dissected like we used to do to frogs in biology class back in high school. I endured years of frustration seeing so many doctors and specialists, I can't even count them all, and receiving every test possible from blood tests to x-rays, CAT scans, MRIs, before finally I got a diagnosis 4 years later at the age of 26 that it was fibromyalgia. At that point, it was kind of a relief to finally have an answer, except the fact that the answer came along with, well, we don't know what causes it, and there's no cure or real true treatment for the disease, led to a whole nother level of frustration and fight. I'm now 33, and the problems have progressively worsened, causing not only pain but depression issues and an overall weakened immune system due to the constant taxing, causing me to be constantly ill, and I struggle to live a normal life. I've had to change professions, lost jobs, missed out on time and activities with my children, but I continue to fight to live a normal life every day, down to making dinner for my kids and making sure they get a bath, making sure I get my own shower. Fibromyalgia is truly a debilitating disorder that not only impacts the quality of life, but can also completely hinder day-to-day activities as simple as taking a shower, dressing, cooking, cleaning, etc., ultimately leading to a person becoming partially or completely disabled altogether. However, due to the lack of information and knowledge, it's very hard to get an approval when applying for disability assistance. I've been fighting myself now for over 3 years to get some disability help, and it's impossible. So I continue to plug along and work when I can, and then I'm working towards my degree to become a teacher, actually, and pass on some of my knowledge to the next generation. While I may have this disorder, I refuse to let it have my livelihood. So I continue to make the best of everything that I can, and I've had to accept and learn to adapt to what I can do on the good days and not feel guilty on the bad days when I have to rest and just clock out from life for a little while in order to give myself time to recover. It's for these issues that we definitely need more funding for research so that there can be more information available, and disability really needs to be taken seriously as a disability by the government and insurance companies. And I hope that if you do have someone in your life with fibro, that now maybe you can help them out a little more just by being a little more understanding. I know having a good shoulder to lean on is more beneficial than any doctor's visit a lot of times. So I hope this helped you a little bit to understand, and I hope that from now on that if you see something supporting fibromyalgia research, that you support it yourself and share it with others. Thank you.